Hi everyone, and welcome to another physics webinar. So this is part of the Making Physics Easy series. This is a series of webinars which is organized by Revised Radiology, and it's intended for radiologists who are sitting the FRCR Part 1 physics exam. So it's based on the FRCR curriculum, and it's going through that curriculum step by step. And we'll be discussing all the topics in the curriculum during these sessions. So it's supposed to be a companion to your preparation. So while you're also studying from your RITI modules and your textbooks and filling out MCQs, if you find it helpful to learn when somebody's explaining the topic to you in a presentation like this, then you can log into these webinars. We also have MCQ sessions, which are based on these webinars as well. So once a week, we have an MCQ session where you have a chance to answer MCQs like the ones asked in the exam. And we also have a discussion around the questions after that's done. So it's just intended, and the sessions are held every week. So if you attend the sessions and also spend other time outside the sessions in the week preparing for the exam, I think in a few months you will be able to pass your physics exam. And that's the goal of this webinar series, is to help you do that, prepare in a systematic way. Okay, so let's look at, so before I get started with the presentation, I'll introduce myself. So my name is Joanna Koshi. I have a BSc in physics and an MSc in nanoscience, and I'm part of the faculty at Revised Radiology. So I've created this physics course together with Dr. Koshi Jacob, and we've done this by studying a lot about the FRCR physics exam, as well as the by speaking to trainees who pass the physics exam, consultants who are involved with teaching physics, etc. Yeah, so that's who I am. And so before I get started with today's lecture, this is just to let you know that this session is being recorded. So if you don't want to appear in the recording, you can keep your mic and your camera off and you won't appear in today's recording. And the recordings of all these sessions are uploaded to the Revised Radiology website. And if you have either the Part 1 Physics or the Part 1 Combined subscription, you get to access all of these recordings in your dashboard. Okay, so let's jump right into today's topic. So today we're discussing single photon emission computed tomography. So this is a form of radionuclide imaging, and they've also used computed tomography techniques in the imaging to construct the images. So if you look at these images on the screen here, which I've taken from iaea.org, you can see that these images have both functional information as well as anatomical information. So the functional information is based on the way that the radionuclide is interacting with the patient's body, the different processes and distribution mechanisms, as well as the physical aspects of the radiation which comes from the radionuclide. So all of that imaging is picked up, all of that information is picked up by a gamma camera. And at the same time, the anatomical information about the patient's body is picked up using CT techniques. And then these can be combined to give you the kind of image that you're seeing on the screen here, where you're getting two types of information that are put together in one image. So today we'll just be looking more at how these kinds of images are produced. An important thing to note with SPECT imaging is that it's quite technically complicated. So when you're a radiologist who's looking at these kind of scans, if you have an understanding of how the scan is produced and what kind of issues can arise while producing the image, then if you see something like an artifact, or if you're not able to get the desired image quality that you want, you'll have an understanding of the way in which those things arise, which will be helpful to you when you're looking at the image. So since there's quite a lot of different types of information that you need to know while looking at an image like this, we've already looked at radionuclide imaging in this webinar series. So an understanding of how radionuclide imaging works, how the gamma camera works, and then how, you know, CT imaging works as well. So when you're looking at the image, if you have all of this background knowledge in your head, that will be helpful to you in interpreting the image. And most importantly, if there's artifacts that have arisen due to the image formation, you know, some mistake in the which was made while acquiring the image, you will be able to spot that as well and think of like a solution. So yeah, that's one purpose in studying the physics of SPECT systems. So there's a few different aspects when we're trying to understand single photon emission. So we've got to understand what is the kind of equipment that's involved in creating the image. What is the process of data acquisition and slice reconstruction? What are the factors which influence the image quality? How is the image finally displayed when you're looking at it? And what are the clinical applications of this type of imaging? So in today's session, we'll just be covering the first two aspects, the first aspect actually, which is just a little bit about the equipment which is used for forming these kind of images. And we'll also be talking about some quality control measures that have to be undertaken for this kind of equipment so that we ensure that the radiologist is finally getting a good quality image, which is reliable, and you're getting the important clinical information from that. Okay, so let's first look a little bit at what are the features of SPECT, how is it different from planar radionuclide imaging. So the image which is produced is a cross-sectional image. So, and what happens is that a radiopharmaceutical has been introduced to the patient's body. The radiopharmaceutical will be distributed in the patient's body, and it will start emitting gamma photons in the form of radiation. So the radiation which is involved in this case is not like X-ray imaging, where the radiation is coming from an external source like an X-ray tube. The source of the radiation in SPECT imaging is coming from within the patient's body. And the image that you're looking at gives you a cross-sectional image of what is the distribution of the radiation from the radiopharmaceutical in the patient's body. So that's the kind of image that you're getting from SPECT. Now, what is the radiation process that's involved here? It's one of the types of radioactive transition which happen. So this type of transition is called an isomeric transition. And you can see what's happening there in the equation which is given on the screen. So what you have is a radionuclide, that is a nucleus which is exhibiting radioactivity, and it's in what is known as a metastable state. So if you're not sure what a metastable state is, it's essentially a transitional state in which the nucleus has certain extra energy, which it's able to lose in the form of gamma radiation. So the actual equation which is involved in the process is shown on the screen here. What you have to know is so if you're looking at the symbols on the screen, you can see that the radionuclide on the left-hand side of the equation sign has the word M, which is written over there. And what that means is the nucleus is in a metastable state, and it's transitioning away from that metastable state, and it's transitioning to its isomer, which is not in the metastable state. And in doing so, it's emitting a gamma photon. You can also note that there's no change in the atomic number or atomic mass number of the nucleus. And that's because the gamma radiation is a photon. So the nucleus is not losing or gaining neutrons or protons. So that's an important thing to note about isomeric transitions. So when the radiopharmaceutical is in the patient's body and the radiation is being emitted, the fundamental physical process, which is emitting this radiation, is the one that you have on the screen in front of you. So the important thing to note here is essentially that the radiation is in the form of a gamma photon. The gamma photon is doesn't have mass or charge, and yeah, so that's the important thing to know about the physical process. So what are the different types of radionuclides that are commonly used for this kind of imaging, and what are their photon energies? I've just put that together in a table for you. So a very common one is technetium 99. The photon energy is in the range of 140 kiloelectron volts. Iodine 123, which is 160. So just by looking over this table, you'll gain an understanding of the range of photon energies which are involved. There's thallium 201. So that has photon energies 68 to 80. Indium 111. So there's two different types of gamma photons which are emitted with two photon energies in the case of indium 111. Gallium 67. In this case, there's three types of gamma photons with three different energies that can be emitted. Okay, another important thing to note about the emission here is that the radiation is emitted from within the patient's body, and it is emitted in all directions. So the camera head needs to pick up the radiation coming from all the different directions. And then by using CT imaging techniques like back projection, etc., they'll reconstruct the image by picking up all of this. They'll go around this circle that you see on the screen here, catch all of the photons, and then use imaging techniques like back projection to create a 2D image of cross section of the area that you're interested in. So, yeah. So as I said before, your techniques of image reconstruction here are similar to techniques in X-ray CT imaging. So if you're familiar with those techniques, those will apply here as well. Some other features of the image is that it has low spatial resolution and high noise. So low spatial resolution means it's difficult to see small anatomical structures. High noise means that there's a lot of additional information in the image which we don't want, which is going to obscure our features of interest. So those are some features of the images which are created with this kind of imaging. So what are the reasons that the image is produced in this way? So those are features of the kind of equipment that's being used, features of the process which is put in place to capture the images. So the gamma camera system has a low intrinsic spatial resolution. The detector and collimator combination has a poor efficiency. So we're not able to accurately pick up all of the photons which are being emitted. And there's also a constraint on the maximum administered activities that you can use for reasons of patient dose, etc. So just in case anybody is not aware, the radionuclide that you administer has a certain activity, and depending on how long that radionuclide stays in the body and the activity which is involved, the patient receives a certain dose. So the examination time, and it's not the same as X-ray imaging where the dose to the patient depends on the examination time. Instead, what you're concerned about in this kind of imaging is the activity of the radionuclide which is being used, and the way, how long it's basically going to remain in the body, and how long the patient is going to be exposed to the radiation. So everything that the radionuclide comes in contact with acts as a further source of radiation. And that's something which is important to keep in mind when we're talking about administering radiopharmaceuticals. So these are all the features which lead to the image having a low spatial resolution and high noise. So it's basically the construction of the gamma camera system, the detector and collimator combination, and the fact that there's constraints on the activity due to patient dose. Okay, so let's just take a look at what are the comparisons between planar radionuclide imaging and SPE-CT. So this is not exactly a disadvantage, but the planar imaging is giving you a 2D image of a 3D distribution. whereas the SPECT is giving you 2D slices in the transverse plane, and you can get reconstructions in the coronal, sagittal, and oblique planes. So yeah, I think that's pretty clear. So a disadvantage of planar imaging is that there's limited information of depth, and one of the advantages of SPECT is that there's improved depth info, and because of the way that the image is created by using these CT techniques, there's also a better localization of structures. In planar imaging, there's also a loss of contrast at depth due to the superimposition of activity at different depths. So just think about it this way. We know that everything that comes in contact with the radionuclide becomes a further source of radiation. So when the radiopharmaceutical has been administered to the patient, think of it as, think of all the points which have become source of radiation as being glowing points. So so imagine if you're imaging the liver, for example, if you can just picture the liver in your head, and then think about the radiopharmaceutical getting distributed throughout the organ. And then everywhere that the radiopharmaceutical goes, imagine it as a glowing point, and that glow is essentially radiation. Now, when you're trying to pick up what is the activity at a certain point, you're going to be seeing the glow from all the surrounding areas. And if you've looked at the night sky when there's a lot of street lights, you can see what I mean. In cities, the night sky is often not dark because the glow from street lights gets diffused throughout the sky, and the whole area becomes brighter. So it's a similar thing which is happening here. All the different sources of radiation are emitting their own radiation throughout the structure. And so you can't say that the activity here is because of the radiopharmaceutical at this exact spot. What you're actually getting is the sum of the activity from all the nearby locations. So this is one of the disadvantages of planar imaging, is that you're losing contrast because the activity from all the surrounding areas are getting traveling, finding their way to the spot that you're looking at, and you're not able to distinguish between them. Yeah, so there's a loss of contrast for that reason. However, what we do in SPECT is that we're using CT techniques to create slices, and then the computer is reconstructing the image in such a way that the effects of activity outside the slice are reduced. So when you're looking at the activity within a certain slice, you can be sure that the activity you're looking at is coming from sources within the slice, and it's not bright or it's not dark because, or it's not bright because there's some sources of radiation outside the slice that you're looking at. And that's a feature of the kind of reconstruction algorithms that you're using over here. So that's one of the advantages of SPECT. All right, so now let's talk about what do we need in order to get this kind of image. We've looked at what kind of, so far in the session, what we've talked about is we've seen what kind of image SPECT gives, what kind of information we get from that image. We've talked about what, the contrast, the spatial resolution. We've also compared why do we need this technique instead of just sticking to planar radionuclide imaging. So now let's move on to how the image is actually constructed and what are the conditions for producing images which are usable by the radiologist. So first of all, we need to talk about the radiopharmaceutical itself. The distribution of the radiopharmaceutical should not change significantly within the acquisition time. So so the distribution of the radiopharmaceutical depends on biological processes within the body. If the distribution is changing a lot in the region that you're looking at within the examination time, the computer will not be able to understand why that kind of change is coming, and what you will get is an image without any usable information. So one important condition to get these images is that you have to know how the radiopharmaceutical is getting distributed within the organ of interest within the examination time. So you have to be able to correlate those two things. Usually for these kind of examinations, the image acquisition time is 20 to 40 minutes. So if you're aware of what kind of processes are affecting the radiopharmaceutical distribution, you just need to think about the time period of those processes versus the image acquisition time of the imaging. So when we're talking about these parameters such as image acquisition time, it's a trade-off between, is the distribution going to change, and are we going to be able to pick up enough photons to actually get a good image? So the longer that the examination continues, the higher is the number of photons that the detectors are able to catch. So we know, first of all, the number of photons which are emitted is a function of time. So as time goes on, the number of photons being emitted increases. And also the detector is also only able to absorb a certain percentage of the photons which are emitted. So the examination time has to be of sufficient duration that we're able to catch enough gamma photons to create a good image. And this is especially important because this is a high noise type of imaging. So the way that we keep the noise to an acceptable level is by picking up enough gamma photons. Yeah, so the way that you can think about this is just picture a person singing a song during a thunderstorm, and somebody's trying to record a person who's singing a song during a thunderstorm. So if the person is singing the song extremely softly, when you listen to the recording, what you'll hear is mostly the sound of the rain and the thunder and not so much the sound of the singing. Whereas if the person is singing loudly enough, when you listen to the recording, you'll hear the song very clearly. And in the background, you'll be able to hear the rain and thunder, but you'll be able to focus on the words of the song, the rhythm, the tempo, etc. So it's exactly the same thing which is happening here. If you don't have enough, the number of gamma photons that you pick up from the patient's body is how loudly the organ is singing to the detector. So if you don't pick up enough gamma photons, the only thing you'll be able to see on the image is the noise. And the more the number of gamma photons you manage to get from the patient's body, the clearer will be the structures that you're looking at. So once again, it's a trade-off here between, the fact that the pharmaceutical won't stay in the same position in the patient's body for a long time, and the fact that you also need to have the examination be long enough to pick up enough photons. So that's one of the trade-offs that we're looking at here in the imaging. So these are a few examples of images that you get by this type of method. So this is a picture of an image of cerebral blood flow, and it's an image taken from StatDX. And on the right-hand side, we have an image of myocardial perfusion, and that's from the Diagnostic and Interventional Cardiology Center. Okay, so with all of this in mind, let's start looking at what is the equipment that is involved in taking these kind of images. So first of all, we use a rotating gamma camera system. So what's going to happen is that the patient is in the center of the equipment. The patient is emitting radiation in all directions. Now we have the gamma camera system, which is able to take pictures of the photons coming from the patient's body. So the gamma camera will rotate in a circular motion all around the patient and catch the photons coming in every direction. And then the computer will stitch together those images and create an image which looks like the image on the left-hand side. So there's different types of setups that are used for this. And most of the modern setups have a dedicated tomographic system, which is used for the slice reconstruction. The type of detectors that are used in this type of imaging are 2D detectors. So they're automatically multi-slice devices. So they have a large field of view. They're capturing multi-slice information, and they're imaging a large volume of the patient's body at the same time. So if you want to understand how this kind of imaging works, you need to review concepts related to multi-slice CT imaging. I think we did an MCQ session on that on Monday. So yeah, you can refer to that on the dashboard if you're interested. I think we'll also be doing sessions on multi-slice CT imaging soon. Okay, so you can have either a single camera system or you can have a multiple camera head system. And a multiple head camera system is preferred because first of all, the field of view is larger. It's housed on a gantry with slip ring technology. That's just to enable that smooth circular motion around the patient in order to pick up radiation from every direction. The other advantage of having a multi-head camera system is that there's a shorter image acquisition time. So you'll be able to pick up enough photons within a shorter image acquisition time, and you don't need to be worried about the radiopharmaceutical distribution changing too much. So you can also have a hybrid system, which is simultaneously acquiring both the radionuclide information, the functional information, as well as the CT information using an X-ray source. That's the anatomical information. So how this works is you have your gamma camera heads, which are going to pick up the photons and give you the functional image of the organ. You're also going to have an X-ray source and detector, which is positioned between these camera heads. So the patient will also be irradiated with X-ray radiation, and the anatomical image will be constructed, and both the anatomical and functional images will be fused together. One benefit of this type of hybrid system is that the CT info can be used to correct the SPE CT image and get a slightly, an image that's better for the radiologist to look at to pick up the features of clinical interest.